There are 5 more ICU hacks from someone who's been an ICU nurse for 9 years. If you are giving multiple blood products to your patient, chances are you also need to be replacing their calcium as well. Blood products contain citrate, which prevents the blood from coagulating when it's in the bag. However, citrate likes to bind with your patient's calcium, therefore lowering their overall calcium levels. So if you're giving your patient multiple blood products, you definitely need to be keeping an eye on their calcium. If your patient has low magnesium and low potassium, replace your magnesium first, because potassium replacement will be ineffective until your magnesium is replaced. Magnesium is needed with the sodium potassium pump. And so if you do not have enough magnesium, your patient will continually be deficient in their potassium. Your patient's serum CO2 level on their basic metabolic panel is going to be about equivalent to the patient's bicarb level on an ABG. So if you don't have an ABG on your patient, but you look at their serum CO2, this is going to be an estimate of what the patient's bicarb would be. 9 times out of 10, if your patient's arterial line is not optimally damped, it's the positioning of it. Now, that's not the only troubleshooting hack for arterial lines. There's other things as well, but the majority of the time, it's your patient's wrist needs to maybe be bent a little bit differently. My last hack is sedation vacations are an art, not a science. Yes, there are policies and protocols for sedation vacations, so I want you to be aware of that. However, I also want you to know that your 90-year-old grandma that's on just a whiff of propofol probably can handle you just shutting that off, but your 18-year-old patient that is in for a drug overdose that has a very high tolerance to these types of medications, that's maxed on 3 different types of sedatives, not going to be very happy when you just shut them off. So you got to kind of balance both worlds. If you want me to talk more about this, I can, but just know it's not the same for everybody. And you kind of have to learn with time and experience which patients are going to tolerate you just shutting sedation off versus which patients need a more gentle, gradual approach. I could talk ICU hacks all day, so let me know if you want a part 3.